Welcome to another beautiful, educative and entertaining moment on healthy living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. Now, the journey of being pregnant can be a roller coaster one for expecting mothers. The wish of these women would be to ensure that they carry their babies to full term. Hence, the quest for the best way to care for the growing fetus. During this period, several advices are given on how and what to do to keep the mothers safe, and everyone tends to become doctors to these expecting mothers, giving them mostly unsolicited advices. Today, we'll discuss one of the most and less ignored way of safely carrying the fetus in the womb: exercise. We'll discuss exercise in pregnancy with gynecologist Dr. Hilary Ozoh. You're welcome, Dr. Hilary. Dr. Hilary joins us virtually on Healthy Living. All right, Dr. Hilary, talking about exercise in pregnancy, we've always heard about it every now and then. While some people think it's a bad idea, some think it's a good idea. But what is really exercise in pregnancy?
Okay, now exercise is it's a lot of things actually.
Okay.
It's a lot of things. So moms see it as whenever it's exercise, some moms are thinking of just the normal doing this or maybe going for a walk or all of those kind of things. But it encompasses a lot of things. It encompasses various things in pregnancy. It has its own benefits that it's going to provide as well.
Okay.
So there's a whole lot, more like a general topic. It's more like a general thing in itself. You get. So
Sure.
exercise in pregnancy is expensive. It comprises a lot of things.
Okay.
It comprises as far as preparing during the different trimesters, the first trimester, the second trimester, different exercises, and trying to group them into each stage and how to prepare for them effectively. So what I'm going to do here is that I'm going to give a full-on extension on exercise. I'm going to talk about exercising. I'm going to talk about why you should exercise. I'm going to talk about how you should exercise and what you should avoid, as well as a lot of useful tips in between that will help you as a mom. Is that okay?
Absolutely.
Now, usually at about 11 weeks or thereabout is when I tell my moms, you need to start exercising. You need to start exercising. Baby is beginning to look like a human being. And baby is about the size of a lion, it's about 4 cm or thereabout. Baby has even started to develop eyebrows, of all things to develop at that point. And the urine, baby has already started peeing as well, and the urine is what forms the...
Oh, babies pee in the womb?
Yes, they do.
Wow.
They do actually. Yeah. So that urine is what forms the amniotic fluid. That's the water breaking. You get that kind of thing. Yeah. So some moms will come to me and they'll be like, Doc, I'm not in the mood. First trimester is still giving me shade. Still showing me pepper, that kind of thing. So I'm tired. I'm not strong enough to start. So moms will be moping around. They don't know what to do. They don't know the exercise they should do at this stage. They don't even know what to indulge in at all. Okay? And that's what we're discussing today.
Okay.
That's what we're looking at. Now, the first fact every pregnant mom should understand and should know is that exercise is the number one, the number one best thing to reduce the risk of pregnancy complications, and 2, to prevent maternal, physical, and mental health. So those 2 things, it helps with reducing a lot of pregnancy complications. And the second thing is that it helps in improving maternal, physical, and mental health. There's a lot of medical conditions, medical conditions that happen here and there that a lot of pregnant moms can avoid simply by exercising. It's that simple. I'm going to mention a number of them.
Okay.
Take preeclampsia first. Okay, preeclampsia is your high blood pressure as well as the protein in your urine together. Those are the 2 main factors that can cause preeclampsia. Okay. Now, as a doctor, when trying to solve medical conditions, because it's very different from an illness. Okay, if you have malaria, for instance, I say, okay, what causes malaria? It's a mosquito. You get. Yes. Mosquito is the direct cause of malaria. It's that simple. It's direct. The cause and effect is very limited. But when it comes to medical condition, there is a lot of factors. There's a lot of possible factors that encourage this medical condition to happen, and there's also certain factors that will help it prevent it from happening or reduce the chances of it happening, or at least help a mom who is currently having that medical condition, help in her treatment and help in her health. So it's totally different from an illness, okay? And in something like preeclampsia, there is the high blood pressure and there's a protein in urine. And high blood pressure is a medical condition, and it stems down from the certain root causes. The first root cause is the lack of proper rest. The second is the overload of mental stress in it. You get. So these two things, the mental stress and the lack of proper rest, are things that are the root factors that contribute to a high blood pressure, especially when it's pregnancy induced. So this is where exercise comes in. Now, exercise does two things.
Sorry to cut you, Dr. Hilary. If you talk about high blood pressure and you talk about exercises, I think some of us that are not medically inclined will be wondering what's the relationship, especially because we know that high blood pressure is like excessive pumping of the blood around the heart, right? So if you're doing exercises, aren't you also stressing?
It's very, very different. Okay. Now, if you're doing exercise, there are certain things, there are certain factors that induce blood pressure. Some are termed physiological, some are termed pathological. You get. When it gets to a point where it's now a condition that is staying with a woman or staying with whoever it is for quite some time, for quite a long time, then it becomes pathological because it's a condition that needs treatment. For exercise is more like a situation. It's more like a temporal. It's temporal. You get. It's not something that stays. So with exercise, what it does for you is that it works on the muscles and it releases hormones that help motivate relaxation and rest. Okay. And when you try to exercise, for instance, if you've noticed, maybe you've gone for a run, you've done some jogging here and there, you notice that you're done after an intense exercise, that your muscles are sore, they're tired. You get. That's the first thing. And now your muscles being tired are trying to stimulate your body for rest. If you've ever tried to do a cognitive activity, maybe try to read after an exercise or something, you're going to find out that you're not going to read as properly as you would have in a relaxed state because of that tiredness, that feeling of tiredness. It contributes to. Okay, so that muscle tiredness, as well as the hormones released, the two major hormones released during exercise are endorphins and adrenaline. Adrenaline is during the active exercise, and endorphins is during the ending and as well as after the exercise as well. It leaves you that kind of feeling. Okay. So for a mom who is having a lack of proper sleep, because a lot of pregnant moms have lack of proper sleep for different reasons. You could either be suffering from pregnancy insomnia, or this type of moms they go to bed and they wake up and they can't go back to sleep again.
Sure.
You get that kind of, it happens. So what a muscle soreness does for you is because it's stimulating your body to rest. Your body, you find out that you'll be able to sleep for longer and sleep even better, much better. All right. And then you look at the second factor. What was the second factor we talked about? We talked about lack of proper rest and the mental stress. Yes, the mental stress. Now, these endorphins and the adrenaline as well, more specifically the endorphins, these things help contribute to relaxation inside the brain. Again, so you tend to feel better. You feel lightheaded. That is why, if you notice, whenever you do an exercise, maybe you do a proper workout, you get home, you take your bath, you rest, you come back to be down and maybe just get some rest. Usually notice how you feel. You feel very lightheaded. Almost like someone who took alcohol and is tipsy but not drunk. You get that kind of thing.
Very well.
So it's how exercise works for pregnant. So you've looked at that big part of it, that big part of preeclampsia, because we're talking about preeclampsia at this point. You get. So you look at the first major causation, which is the high blood pressure. You see that part on its own, it's a medical condition that could happen spontaneously, but engaging in exercise will definitely reduce the risk of it happening. You get that kind of thing. That's how it works. The same with protein in urine. protein in urine is the second thing as well, the second major factor that contributes to preeclampsia. And with protein in urine is a whole lot of other symptoms. Majorly, it's the efficiency of your kidney reabsorption. That's what it's majorly about.
Oh.
Because when protein is in your urine, it shows that your kidney is not collecting back. There's something called collecting tubules inside your kidney, and when you're trying to urine, during the process of filtering your urine, they tend to collect back the minerals inside your urine to be able to just to release urea and water majorly. So that's how it works.
Sorry to cut you. It's more like you're opening us up to a whole lot of things, especially some of the things that people misunderstand. Because first of all, like when I was giving my intro, I said a lot of people become doctors to pregnant women and they tend to give them even unsolicited advices. People believe that when there is protein in your urine is because you're not taking water. So they don't even look deeper to see some of these aspects you're opening us up to.
Taking water in itself helps, because when you're dehydrated, for instance, you tend to see that your urine is more colorful. Maybe it's yellow, maybe it goes as far as orange. You get this kind of thing. With protein in urine, there is a lot of certain factors involved. There is the water intake. Water intake helps as well. There is the level of the protein in the diet too, and then there is the kidney as well. You get. So these things play their own roles, and exercise being its own mechanism helps with your body health and helps with with the movement of the muscles and certain other factors, certain other elements in the body. It helps your body system be more transient. Yes, be more transient. It's easy for certain substances, you could call them that, to move through your body properly. You get, because of how your body is due to exercise. In simple terms, I'm trying to make it simple for someone to understand.
Of course,
that's the when it comes to protein in urine, it's a whole lot of factors, and exercise in itself can help with that as well. Majorly as well with the high blood pressure. Okay, that's it. So I don't delve too much on preeclampsia because we don't have time, as you told me. Okay, it's not much of a time, so I'm just going to give you another
instance. Face other factors.
Now, another thing moms can look at is the C-section. The C-section. When it gets to preparing for delivery, some moms want different things. You get, but some moms they want the vaginal. For some moms they want an elective C-section as well, and either of them is fine. It's all about the options you're down to. But for a lot of moms, as you may have, you get, a lot of them tend in the end to have emergency C-sections that they did not want in the first place. You get, and an emergency C-section happens for various reasons. It could happen because of certain medical conditions. We've talked about the preeclampsia, for instance. We could talk about the dilation and the slow dilation, getting into prolonged labor. You could talk about the baby not fitting through the head to the cervix. You get, so doing exercise as well prevents the medical conditions of, say, things like high blood pressure as well from happening. It prevents those root factors, but not that alone. Not that alone. If you get to things like dilation and things like the baby not being able to pass through the cervix in time, you begin to see that there are certain exercises a mom could have done to actually prepare for these things beforehand. Take pelvic exercises, for instance. You get, if you look at pelvic exercises, you look at perineal massage, you look at squatting, you look at certain exercises you could do with a bed ball. These things are things that, if you look at them, if a mom is indulging in them, she puts herself at an increased likelihood that her delivery will be faster and much easier. Reduces the chances of all this prolonged labor and a lot of other things happening that not necessarily a mom who didn't go through these exercises and all of that would not have access to. So these things are things that a lot of moms don't do, a lot of moms overlook, and they just go on with delivery just like that. And you go for a vaginal delivery, come out with an emergency C-section. And the C-section is not because the doctors want you to have a C-section. It's because it's now necessary due to certain reasons. And these are things that can prevent it. It gets to the root causes again, just that same way.
Okay, before you talk more on that, sometimes people believe that exercises could actually cause miscarriages. And these days, when mothers go to the hospital, expecting mothers, you barely find most of these health practitioners teaching them what to do when it comes to exercises. It's more like they just ignore it completely. At the end of the day, the traditional means comes in. They'll say, don't do exercises, you don't have to stress yourself. And then some doctors also would prescribe bed rests. So what happens in that case?
Okay, now there's two types of pregnancy. There
Okay.
is the low risk and there is the high risk pregnancy. Okay.
Oh,
Now, if you're a mom with a pregnancy without any contraindications, I have this in mind as well coming here. Contraindications basically refer to things like unexplained vaginal bleeding, and maybe you've had a medical history of preterm birth, or you've had a medical history of miscarriages. You
okay.
get that kind of thing. All these moms, usually, they are high risk pregnancies in themselves. So even a mom who has multiple pregnancies, for instance, mom carrying triplets or a mom carrying twins, these things are high risk pregnancies, and the approach is always going to be very different from a low risk pregnancy. How it works, you get. So for a low risk pregnancy, you can definitely exercise. It's all about certain exercises that are fine to do at a certain stage and certain exercises that are not fine to do. If you're carrying a low risk pregnancy, for instance, you can do a lot of exercises. You can do the cardio, you can do the yoga. There's a lot. There's only few restrictions. Of course, there's the high impact exercises every pregnant woman will avoid. And then there's the things like sporting, for instance, that you live for the third trimester. You get. But when it
Yes.
comes to a mom who is in a high risk pregnancy, maybe a mom who has been having bleeding and all of that, it now depends on the certain condition in itself. If it's a mom with twins or triplets, she's going to be consigned to maybe very limited exercise. Not that she'll be totally cut off from exercise, but she'll be limited. If others are doing something for about 30 minutes, you'll do it for about 10 minutes or thereabout. It's very, very minimal compared to that. For
Okay.
someone who is carrying a high risk pregnancy, maybe vaginal bleeding and all of that, a lot of the time, due to the reason that they want the baby to stay, okay,
Yes.
the doctor prescribes bed rest. She limits her physical activity. It's not only about exercise in itself, but also limiting physical activity for the mom in order to make sure that the pelvis, that area, is not overworked in that sense. Okay. Most of the times, these moms are even confined to hospitals because they have different reasons, and they need all these injections, progesterone injections, and all these things to help the baby stay. All these things are what comes along with a high risk pregnancy sometimes. In fact, I have a mom who I've been dealing with personally. Her name is Gloria. So she's had a history of a miscarriage, and then she's been carrying twins, and already she's lost a twin. So you see how these things work. She has to be consigned to a lot of bed rest. She has to be taken care of. Her physical activity has to be limited, and we even advised her to get maybe her mom or her mother-in-law, to be someone there to help with the cause and most of the things. It all depends on the pregnancy itself. If it's the high risk, then there are limitations. If there's low risk, then it's totally fine to exercise. Totally.
Okay, so that means there are no specific exercises for high risk.
No, high risk depends on this particular condition in itself and the extent of the condition. The extent of the condition. Another medical condition. I'm going to just highlight another medical condition before we begin to go into recommendations for exercise for pregnant women and all of that. Another medical condition is diabetes. Diabetes, and you see the two main. We're talking about root factors again, just like we talked about in preeclampsia. We're talking about root factors again, and the major things that are linked with diabetes is gestational diabetes, to be exact. That is pregnancy-induced diabetes. Maybe you've not been diabetic before, or you got
Yes.
pregnant and you became diabetic. You get that kind of thing.
Very
So
well.
the major root factors in this sense are: one is excessive weight gain. Okay, excessive weight gain, and the excess of calorie intake, because your calories are definitely a very huge aspect of your your body metabolism and how it reacts. So if you get to if you're pregnant during the first trimester, you're going to have to add some weight. You definitely have to add weight during pregnancy. It's not something that you just have. It's important. It's good for you. It's good for your baby. It's healthy. You get, so you have
But
to
do
add some
all
weight.
pregnant women add weight?
Yeah, it's necessary. Yes, it's necessary.
Okay.
Necessary. Now, if you get to your first trimester, you're going to add about 1 to 3 kg. About 1 to 3 kg. And then as you progress towards the second trimester, up to the third trimester, you start to add about 0.5 kg every week or thereabouts. You get. I had this mom the other time that came to me and she was like, "Doctor, I'm 28 weeks, so what's my kg supposed to be like?" And I'm like, "It's supposed to be around 1 kg or thereabouts." And she's like, "Wow. So the rest of the kg is going to add up in just 28 weeks. It's very, very small time." So you get that kind of thing. It's most of the bulk of the baby's weight is going to add up in the late second trimester, in the third trimester. And that's how it is. So you're definitely going to add. It's important. But it gets to a point where it begins to be excessive. It begins to be more than it's required. Okay. Now, when 1 to 3 kg is the required, the recommended amount of kg that you're supposed to add in first trimester, and you're going to see a mom who is adding about 5 kg or 7 kg. Okay. Now that's an increment. That's a lot more than she requires to. So you tend to know that, okay, it's either that physical activity is so reduced that she's not been able to, because most of these moms, it's not necessarily that they increase their feeding overnight. It's more of, I'm pregnant and my workload reduces. I'm not doing much anymore. I'm resting because I'm feeling nauseous. And
I was wondering if they have to eat
this
to add up or take some vitamins or anything.
Yes, they have to. You have to eat as a pregnant. You have to. You get. It's very important. But the thing, it then gets to the point where, part of it is due to the lack of physical activity as well. You don't move much compared to when you were not pregnant, due to, of course, the baby and all of that. So you tend to put on more weight. And, of course, for some moms that eat more than is required. Again. So don't get me wrong. You have to eat. I'm specifically stating that because I see a lot of moms that will go and they want to eat carrot and vegetables only. You have to eat. You have to eat very, very well. You have to eat well. But it gets to a point where it begins to be more than you need to. And that's what we're talking about here. Now, exercise can be that physical activity that helps with that calorie balance. Okay. So as you're adding that weight, it helps make sure that that weight is kept at a certain level. It doesn't get more than this. Okay. It stays stable, so that you don't get to a point where you begin to add more weight. And these things have their long-term relations. We're talking about gestational diabetes and excessive weight gain, as well as the increase in calories and sugar levels, more importantly, okay, will lead to that diabetic condition. And that diabetic condition as well will lead to, most of the time, it's almost linear at this point. If you have gestational diabetes and your weight is at a certain level, then it's very, very likely that your baby's weight will be much higher than is required at the gestational age that they're in. So you find a baby at, say, we've used 28 weeks now, and should be about 1 kg or at least 1.4, 1.5 at most, and they're already falling around 2 kg already because it's more than they require. The diabetic condition and all these things involved in that. So this is exercise. Exercise can help prevent that from happening in the first place. It's more like a preventive measure, and it's more like a therapy to deal with it as well. If your mom is already suffering from a condition. So we've talked a lot about a lot of medical conditions. I'm just going to say one final one. Okay. Now, the last I'm going to talk about is depression. Depression in itself. Now, depression can happen for a lot of reasons. The major reason why it's going to happen in a pregnancy is because of environmental factors. First of all, things happening at home. Most times you find out that the couples have some issues, or maybe she feels alone in the pregnancy, she doesn't feel supported, or maybe there is a lot of things happening at home, maybe with other family members, all those kind of things. So you tend to get to the things that affect it at the root level. For some other moms, it's also true that for some other moms, it's the fear. It's the fear of childbirth in itself that begins to envelop into that mental attitude, into depression. So it's that fear that begins to build that up. But for a lot of moms, a good number of moms, in those cases, I just want to highlight this. In these cases, it's best for the doctor or the professional who is dealing with them to try to see if he can ask the couple. Maybe if the woman comes for antenatal on her own or whatever, he has to find a way for the couple to be able to meet so that they can try to stitch up whatever their differences are. Because a pregnant woman has to be cared for. She has to be looked after. She has to be taken care of very well. She needs to feel like there's someone there for her. It doesn't have to be alone in that pregnancy. These things are very important for her well-being and for the baby's well-being as well. So we don't joke with that. But whenever, for a lot of other moms, it could be that, okay, she's a stay-at-home, or she's a mom who is maybe taking her maternity leave and she's now staying at home now. She's no longer working due to her pregnancy. So you see this type of moms, and just notice my head. You see this type of moms, it's what they need is a stimulant. What they need is a stimulating activity that will actually begin to help their mental balance. Yes, their mental balance. They need a stimulating environment. So exercise provides that. Exercise provides that. We talk about the hormones. We talk about the hormones that it releases. We talk about the endorphins, for instance, and the relaxed state of mind that it brings. It helps you feel more energetic. You notice whenever you wake up in the morning, if you did a proper exercise and you went to bed, you went to sleep, you wake up, you feel better. Yes, you feel good. You feel strong. That's it helps with that. So,
let's go on a quick break before you proceed and talk about most of the recommendations you have. All right, viewers, let's go on a quick break. When we return, the discussion continues. Viewers, welcome back. This is Still Healthy Living, reaching you from the nation's capital, Abuja, and we'll be talking to Dr. Hilary Ozoh on exercises in pregnancy. All right, Dr. Hilary, you are going to give us some of your recommendations.
Okay. So, there's a lot of recommendations that you give a pregnant woman to be able to navigate the whole exercise thing in itself. You get. So we talked about the first one.
Sorry to cut you. I just remembered that I wanted to ask a question before we went on that break. You were talking about depression in pregnancy. Before you bring up your recommendations, you were talking about depression in pregnancy. There's something I've also noticed. Most pregnant women tend to get depressed for no reason. Is that supposed to be part of the pregnancy hormones?
Yes, pregnancy hormones happen sometimes. You know how it is on your period at times. If you know, the whole feeling, especially with premenstrual syndrome, the touchiness, pettiness, even small things and all those kind of things. So yeah, in a very, very, it's more like a dynamic state. They need a lot of attention, a lot of balance to actually not fall over. So it's almost like a spinning ball. But you're keeping it balanced with your hand. It's how pregnant moms are. It's very, very, it's a complex situation. And, with a lot of happenings in the body, it's not expected.
All right.
It's why we talk about the family keeping the environment in a calm state so that the pregnant mom can actually thrive and feel comfortable. Now, going ahead with the recommendations, there's a lot of things pregnant moms should be aware of when trying to prepare for exercises and what they should indulge themselves in. The first one, which popped up as a question, when you asked me about the pregnant moms that are confined to bed and all of that, is that all pregnant moms without contraindications should be physically active during pregnancy. All pregnant moms, yes, without contraindications, should be physically active during pregnancy. Now, contraindications, as I earlier said, contraindications are certain medical conditions during the pregnancy that would warrant a limitation of physical exercise. We talked about unexplained vaginal bleeding for some months. They have a lot of bleeding and, it happens so frequently that we have to look into it. For some other moms, you have recurrent miscarriages, you have an old medical history, you have high multiples, those kind of things. All these things are things that play a role inside this. So it's important for you, if you're a mom who has contraindications, you have to speak with your doctor. You have to note what exercise you can do, or if you can even do any exercise at all. It's very important. But when you're a mom with a low-risk pregnancy, you don't have any problems, high blood pressure, none of these things are happening, then you definitely have to exercise. You have to be active. You need to move around. You need to shake your body small. Okay? And exercise is a very good way to do that. It's very important. Now, the second recommendation I'm going to give, all right, is that pregnant moms should exercise for at least a minimum or at least on average, about 2 hours a week, a whole week, 2 hours, you get. So if you're a mom who goes to work or you're doing a lot of things, it's fine. You can break it into certain days. Break it into 3 days, for instance.
Okay.
You work out 3 days, 1, 2, 3. Space it into days that are comfortable for you, and you begin to exercise. It's also fine if you're just starting. So if you're just starting, it's no, you don't have to calculate 2 hours. 2 hours into 3 days. How will I do it? It's too much now, doctor. No, good and fine. Just start. Do 5 minutes, 10 minutes. Any of that is fine. It's also very important, very, very important for the exercise to be moderate. A lot of people don't talk about this, but it's very important. The exercise has to be moderate.
Okay.
It doesn't have to be high intensity.
Before we talk
doesn't
about
have to
being
be-
moderate or not, the 2 hours exercise in a week now, does it have to do with the stage of the pregnancy, or at any stage of the pregnancy you could do 2 hours, exercise?
It varies. It varies a lot. Specifically, this should be for the first and second trimester. For third trimester, there's a whole different program. There's a whole different style of preparation. At least for me, when I'm preparing moms for the third trimester, it's very, very different from a mom preparing for her first or second trimester.
Okay.
First and second trimester is just majorly about keeping your body fit, keeping your body in certain levels, and staying healthy. Third trimester is about delivery, specifically delivery. So it's a whole difference. But if you're in your first and second trimester, then you should try to aspire to that. Not immediately, of course, but with time, you should try to get yourself to the point where at least you get somewhere near that. Okay. Now, for moderate exercise, you have to understand what moderate exercise is, first of all, because it can be confusing. A lot of people don't talk about it. Now, there are two ways to know if your exercise is moderate. The first is how comfortable you are, and the second is your heart rate. Okay, your heart rate. These two things play very strong role. So if you're doing an exercise, say you went to do an exercise, you don't have that baby bump. The baby bump is not yet that big, so maybe you can still jog. Or the baby bump has gotten big enough, so you're just walking. Okay, so maybe you're walking and you notice that you're tired, you're panting. You're panting like someone who had a real endurance run. You get this it's a sign from your body that you should actually step it down. You should actually either change the workout or rest, or more importantly, reduce intensity. So you have to listen to your body at times. That moderate exercise is very important, because you're not training to, you're not training to
impress anybody.
Go for, you're not an athlete. It's not slam dunk or that kind of thing. You're just pregnant and you're just trying to stay fine for you and baby. So it has to be moderate. It's very, very important. Okay. So as I've said, you space it into 3 days a week or thereabout, and with time, if you start maybe 5 minutes a day, 10 minutes a day, with time, begin to get better at it. All right. Now, this doesn't mean that...
Before you continue,
okay.
I've seen some athletes actually train rigorously even while they are pregnant. In fact, I think that those that used to do it a lot before they got pregnant, they tend to continue without slowing down. Will this possibly have any effect on the fetus?
No, for most of these athletes, it depends on the type of exercise in particular. A lot of the times you have to discuss with your doctor about it, and most times the doctor is going to give the lady the permit because her body has been used to this. There's something called muscle memory. Okay? So when your body is used to a certain activity, it can deal with it.
Okay.
It can deal with it, and it won't cause any problems to your fetus. It won't cause any problems to your baby or to you in particular. But if you get to a certain type of exercise, say a woman who is a professional boxer, or you could name any other sport, a high contact sport or something of that sort, then of course there's going to be limitations or even avoidance. Totally. That's how it works. So it all depends on the exercise and of course intensity as well. But athletes usually have a free train. They're usually allowed as much as they can as far as the exercise is fine. Now, as I was saying, it's important if you're on those rest days, we've divided the exercise days into about 3 days a week or thereabout. Those rest days, it doesn't mean that you have to lie down and sleep and not do anything. You still have to be physically active. You still have to move around a little bit, at least. It's very important. It's part and parcel of what you have to. Now, the third recommendation is to add a resistance training to your exercise. Resistance training. Yes. Now, the normal night week is maybe I just take a walk. Maybe I just move around. No, just basically cardio. And that is fine. That is fine, actually. But if you have the time to indulge in maybe a fitness center or a gym somewhere else, you can actually sacrifice or indulge in about 30 minutes every week, maybe on a specific day of your choice, indulge in about 30 minutes of resistance exercise. I'm going to use a very good instance. Take back pain, for instance. Back pain. Now, back pain is a thing that happens to moms so much. It happens a lot. It's more like, if you're a
next
mom,
to
6
headache in
times, 7 times out of
pregnancy.
you're definitely going to have back pain. It's normal. It's part of it. It's, you get. Well, a lot of moms can actually reduce the chances of it happening or manage it by certain exercises. A good one is the back row, the seated back row. If you're at a fitness center or at a gym, a seated back row helps with strengthening the back and the lower back as well, because the lower back is usually the main site of pain for most moms. So why this back and all these muscles are painful and sore is because pregnancy comes with making your muscles loose, your ligaments loose, and it's understandable. You're about to give birth, and your body has to be actually ready to push out a baby. It doesn't have to be stiff. You get, like a mom or a woman who's never been pregnant before. So it's the body's requirements, and that is okay. But it comes with the side effects, of course, and that is this pain here and there, this sense that. So you can try to reduce them with this exercise. There's also other things, of course. There's the posture. For instance, I also tell moms, don't stand for too long. You have no business standing. Whether you're standing in the correct posture or not, it's not ideal. It's not ideal to stand for too long because of the baby bump, you're going to find out that a lot of the time when you're standing, you're going to recline into the wrong position. It's almost subconscious at this point. So that reclining will stress the lower back, and over time it will develop into that back state. So don't stand for too long. It's lie down. There's no point of you standing. You go to the market, try to not take all the time price like you used to. So that's it. Yeah, that kind of thing. So since I've mentioned resistance training, I have to note this. Sporting. A lot of women in general find sporting as a very pleasurable exercise. It's a popular exercise, you get. But when you're pregnant, there has to be limitations. Squatting is a pelvic exercise that should only be done when you're in the third trimester.
Oh.
So it's not something you do when you're in your second trimester, because it can actually open up the pelvis. That's its main function. And opening up the pelvis and, preparing the pelvis at that stage is not ideal, because it could lead to certain situations. That is why we begin to talk about exercises that cause certain complications. It's about doing the right one at the right time. You cannot be doing squatting, for instance, if you're in first trimester or in the second trimester, because you don't put yourself at the risk of a miscarriage or at risk of premature labor and other things as well. So these things play factors. Okay, so since I've mentioned this resistance training at fitness center or at the gym, it's important. It's imperative that I mention it as well. Okay. Now, the fourth.
Is plank an option here when it comes to resistance training?
Well, a mom with a baby bump won't even be able to do planks now. It's going to be more difficult. So.
Okay.
Yeah. Yeah.
No, but we have side plank,
What did you say?
We have the side plank too.
Side plank. I wouldn't recommend. Recommend. Except the mom has been doing it from start. A lot of time, the pressure, you get that kind of thing. If she's starting it for the first time, then you don't want her falling over or something.
True.
So it's better. It's better that way to just focus on exercises that are comfortable for you. Yeah. So the fourth recommendation I'm going to talk about is urinary incontinence. In summary, urinary incontinence. Now, a lot of moms.
What does that mean?
What did you? Sorry.
So what does that mean?
Okay, urinary incontinence, not being able to hold your urine. Sorry, I didn't explain in simple terms this time around. But not being able to hold your urine is called the urinary incontinence. Now, for a lot of moms, usually it's normal. at your late second trimester or at third trimester, you're going to notice the baby has started bearing down on the pelvis. So the pelvis, your bladder, you're feeling like you need to urinate every time. 5 minutes in, you want to go to the toilet. You go to the toilet and your pee will not even be up to 2 drops.
True.
It can be annoying. You get that kind of thing. It happens. But for certain other moms, it gets to a point where they are no longer able to hold that urine at all. If it comes, they have to run to the toilet to go straight up. They can't hold it. And it's because of that pressure. It happens to some moms before they even give birth, and it happens to a lot of other moms after giving birth, after the baby. And things like this, you look at the average age of a pregnant mom. She's in Nigeria, it's about 24. About 24 years. These are still very young women. These are women who still want to live their lives, who still want to feel like they have control over their body. They're not old people. So at that stage, it causes a lot of anxiety. It causes a lot of shame. There is a stigma with it as well. The woman begins to feel less confident about her body and about herself in general. And it's not an easy feeling at all. It's not an easy feeling at all. I can tell you that for sure. So certain things and certain exercises can help. A good example is Kegel exercise. Kegel exercises, Kegel. If your mom is hearing this for the first time, Kegel exercises, that's what it's called. Now, Kegel exercises are exercises that help strengthen the pelvic muscles to be able to hold that urine, so that you will not have to be running to the toilet up and down if you're already having that condition. And if you're a mom who has been feeling that bearing down, that every time you need to pee, but you're not actually peeing anything reasonable, if you could put it that way. Yeah, this is something that can help reduce the frequency.
Okay.
So a lot of you know how to do Kegel exercises, and I have a recommendation for you as well. Okay. The other day, mom came to me and she was like, Doc, you talked about Kegel exercises. Oh yeah, I want you to make a video. Make a video, and you show me how I'm supposed to do it. And I'm like, I'm not a woman, no. You get that kind of thing. You calm down, small boy.
But you
I'm going to give
describe
you a
it
recommendation
so
that is,
swiftly, like you're a woman, and you could actually,
yeah,
show the way it's done. Don't mind me.
yeah. Well, the recommendation I'm going to give, let's not forget, is a channel. So if you're a mom who is watching this, you go to YouTube. All of us have YouTube on our phones and all other places. So you go to YouTube and you search for pregnancy and postpartum TV. Pregnancy and postpartum TV. It's a channel. It contains a lot of helpful exercises for pregnancy and yoga specifically, and also with the Kegel exercises as well. So if you're a mom who does not know how to do Kegel exercises, that is a very good channel for you to look into. I personally recommend it because I've been through there before and I know that what they do is good. So I just had to have that in mind when coming here. I had to recommend that. So if your mom who is having that problem, it's not the end of the world yet. You can feel sometimes like you don't have your body anymore. It's a terrible feeling. But with time it can be managed and it will get better. Okay. Now the fourth I think this is the last recommendation actually. It's if you're a mom who is exercising and you're exercising on your back, for most moms, there are certain yoga exercises that you have to lie down on your back to move in a certain way and all of that. And for these certain yoga exercises, if you're doing this exercise on your back and you begin to feel shortness of breath, begin to feel like you can't breathe as well as you should, then you have to either switch your position or change the exercise. It's important. So if your mom who is looking at a lot of yoga exercises and trying to inculcate that into your exercise routine, it's something you should watch out for. If you're having that shortness of breath, if you feel like that, then you actually have to switch positions or reduce the intensity of the workout. Not intensity, but change the workout in time. That's it. So you don't want to compress the blood flow. Because most of the times when you're feeling that shortness of breath, it's usually because there's a compression of blood flow somewhere. It's part of why we tell moms with baby bumps, okay, if you have a baby bump, sleep on your side, first of all. If you wake up on your back, fine, it's fine. But at least starting to sleep on your back first. It's important. Okay? So we've been mentioning benefits and recommendations and a lot of things, and I want to also put it out there that, as you've asked me before, a lot of moms that tell you exercise, this and that, it's not safe, all of that, different things, it's simply not true. It's simply not true. So no matter what they tell you, a lot of times, if you're carrying a low-risk pregnancy, if you're doing the exercises you should do at a certain stage, you don't have any problems and you won't have any problems. Okay, it's that way. Another good tip is to invest in exercise wear, in sports wear. If you're working out at home, you work out a lot at home, maybe you're not going anywhere, you're doing the exercise at home, then it's better to get a sports wear because of the mental, the mental aspect of it, the motivational aspect of it, compared to a mom who is just wearing her
Random
home
clothes.
attire, that kind of thing. Yeah. So if you're a mom who is exercising at home, still try to get the sports wear. You might not wear the canvas and all of that, but the socks, you kit up, it actually puts you in the mood. You actually want to do something before you're done. Also, stay hydrated. Stay hydrated. It's important. Drink water. You get. It's not till you collapse. It's not, you're not doing kiriba. Yeah, you're just pregnant. So drink water. It's very important. Okay. If you're a mom who is doing outdoors exercise, you prefer to work out outside, then you have to look at the temperature. Say you're walking, for instance, and the sun is out. It's hot, you're walking, and you begin to feel that, okay, you touch your body, you're tired, and your whole body is hot, your temperature is high. You actually have to stop. You actually have to find the area where there's shade or actually change to another exercise in a more comfortable place. So it's important to note those things as well. Okay?
Certainly.
Now, you've mentioned a lot of them. Just start. You don't need to sign up for all the programs in the world. You don't need to follow every fitness program out there. Just start. If it's working, fine. If it's doing any other exercise, fine. Yoga and all of that. 5 minutes, 10 minutes, and with time, you begin to build up. It's normal. Okay? So, because of how your body, we've talked about how your body and the ligaments, how pregnancy weakens the body and ligaments, then it's important for you to leave high impact exercise and high contact exercise. So if you're someone who fancies basketball, football, boxing, wrestling, if that is even possible, all those kind of
long
things,
jumps.
You actually long jumps, yes. All those high impact, you have to totally leave them behind. They are not safe at all. So you have to leave them behind for you and for your baby as well. Also, if you're someone who is into what's it called? All these recreational activities, maybe riding a horse, for instance, or there's always one mom out there who used to be at the beach, practice surfing, all of these things. These are things that you leave behind because they are not entirely safe. Okay, as we've discussed before, if you're a professional athlete, of course, you have your case is going to be likely different to some extent. So you have to make sure to visit your gynecologist. You discuss with him, you discuss about your routine, and you discuss and find out if it's fine for you to continue that during pregnancy. So that's about that. Now, okay.
Before you round up, before you close up, I wanted to quickly ask a question. What happens to mothers who have gone through, expecting mothers who have gone through tying of the uterus? Can they also engage in some of these exercises you've talked about?
Who have gone into tying of the uterus?
Yes.
Okay. You mean a cerclage or for moms who have a loose cervix or what?
I think I've heard of a lady who lost a baby at first, and then she got pregnant again, and the uterus had to be tied to avoid another miscarriage. So in this case, can someone like that also engage in some of these exercises you've highlighted?
Well, it's also falls under high risk pregnancy.
Okay.
It's So when a mom has that history, it's usually going to recommend a second. You stitch up her step, okay, so that it prevents the baby from falling over again. If you put it in simple terms. So it's also a high risk exercise, high risk pregnancy. I call those things.
Right.
And it's something that you fall under recommendations. For me personally, you have to limit exercise. You have to limit a lot of physical activity since you have a history. Okay. Now we talked about the why you should exercise, but we haven't really touched about how you should exercise. Okay. Now, if you're
we can touch on that in like 3 minutes.
Just in a few moments. Yeah. So, if your mom who is trying to note what exercise you should do and how you should exercise, you have to take this into account. Okay. First trimester, second trimester, and third trimester, are totally different. Okay, for your first trimester and for, let's say the first half of your second trimester, it's more about staying fit, keeping fit. It's more about staying healthy generally, and more so, if you're a mom who has been stretching from the beginning of your pregnancy, it's easier to stretch when you're in your third trimester and nearing delivery than a mom who is just starting for the first time. So you have to know the purpose of or what you're working for in summary. You have to know what you're working for in each trimester. If you're working in your first trimester, you know what you're working for. Oh, I'm just trying to keep fit. I'm trying to stay healthy for me and my baby. For the early second trimester, it's that same way again. I'm still trying to keep fit. I'm still trying to get my body in shape. I'm still trying to dodge so many pains and these back pains and this and that, the go of pregnancy that usually comes along with it. That's what I'm fighting for at that time. But when I'm in my third trimester, I'm preparing for delivery. Okay, it's very important to note that I'm preparing for delivery. It's what I do for moms who are part of my program. Okay, you know what you're working for. We group them. You have videos that you're doing of exercises that you're doing in your first trimester. You have videos of exercises that you're supposed to do in your second trimester, and then you have the specific preparations for delivery when you get to your third trimester and in the late half of the second trimester as well. Okay, so that you don't be a mom in your third trimester and be like, doctor said I should start exercising, so I'll start walking. Maybe you walk from here to there, and you do it for about 30 minutes or thereabout. It will have its health benefits, yes, but in terms of preparing you for delivery, it's not going to have it at best minimum. It's not going to do much for you preparing for delivery. So it's important to note that. It's important to have that in mind. Okay, you do certain exercises, yoga and the likes, all of that, stretching and that. And then when you get to your third trimester, you actually begin to do pelvic exercise. We've talked about pelvic exercise, we've talked about squatting, we've talked about perineal massage, we've talked about you getting a bed ball. Okay, we've talked about pregnancy and postpartum TV the other time. If you go to pregnancy and postpartum TV, I'm talking about them again. You go to their YouTube, you're going to see specific yoga exercises for delivery as well.
Right.
So these things are exercises that you indulge in when you're in your third trimester, so that you know what you're working for. You know what you're looking ahead. Okay, it's very, very important. So I'm going to give a summary of what we've discussed so far. We've discussed about.
We have 60 seconds more.
We discussed about the why, we've discussed about the how, and it's important for you to know the difference. We've talked about certain conditions that will warrant you not exercising. We've talked about the benefits that exercise will give you as well. So I'm going to leave you with a quote by Mark Twain. Yes, that's his name. So he says, the secret to getting ahead, getting started. So once you begin to exercise regularly, the hard thing will not be about stopping. It will no longer be about continuing the exercise. It will be about stopping the exercise. So try to exercise. It will help you a lot, especially on delivery day. So that's about that. So
thank you so much, Dr. Hilary. It's a good place to end the conversation. We really appreciate it. Thanks for the expose. Thank you. Our viewers have been talking to Dr. Hilary Ozoh, a gynecologist, and he's been putting us through everything we need to know about exercise in pregnancy, and I hope you learned something. We'll see you again next week. I am Olamide Alhassan. Bye for now.